The Eye Care Program. 35 years of alcohol, drug abuse, and violence prevention. Serving the East Baton Rouge Parish community since 1981.
Hi, this is Jantrell Johnson with Eye Care Live, and I'm here today with Dr. Rani Whitfield, and we will be discussing substance abuse in teens. So, Dr. Rani Whitfield, tell us a little bit about yourself.
Well, again, it's Ronnie actually. I'm a family practicing sports medicine physician here in Baton Rouge, and I've also done some work at East Baton Rouge Parish Prison as well as a drug rehab, inpatient drug rehab called Centacor. So I have a little bit of experience dealing with some things that can impact our community significantly, especially when it comes to substance abuse.
Awesome. Okay, so what are some current drug trends in Baton Rouge?
I actually reached out to Bo Clark, who was our coroner, and I couldn't get a lot of information just online about Baton Rouge specifically, but in our city, opioids still are one of the key drugs that we have a problem with. When I'm talking about opioids, those pain medications like hydrocodone, oxycodone, codeine, sometimes they're mixed in things like syrups, cough syrups, and these things have high street value. And so opioids were a big deal. We had no deaths, believe it or not, from synthetics in 2016, which is a good thing. That doesn't mean we didn't have a high use of synthetics, but there was still the Mojo and those. There's one synthetic called Pink that a lot of people don't know about. I'm going to talk about a little bit later. So we didn't have any deaths from synthetics, but opioids ruled. The main drug that was obtained illicitly or illegally is a prescription drug, and it's the class of drugs called opioids. So that's pretty much been the trend. Heroin is still a big deal in our community. It's a cheaper form of the opioids. And in our younger communities, many of these people get access to these things by taking their parents' prescription drugs out of the closets or the cabinets. So that's some other stuff we're going to talk to about a little detail in a second here.
Okay. Are there any new drugs or any new ways that teens are experimenting with drugs?
Yeah, I'm glad you asked that question. So let's take our average everyday hand sanitizer. Pretty common in your home, no big deal, right? Young people are now extracting the alcohol, 60 to 65% alcohol from this and drink it. It can be done with cheesecloths and sodiums. There's little ways, and I've actually found a few YouTube videos that show you how to extract the alcohol from hand sanitizer. So that's one thing that I'm not excited about. Cinnamon. Who would think cinnamon would be harmful? But there's actually a cinnamon challenge that was being done sometimes. Other herbs as well that these teens will experiment with. They'll take them in high doses in 1 minute, and it can be caustic to the throat and the lungs. So there's something called a cinnamon challenge that I don't want anybody to try to do. This is one that probably will throw you off a little bit. Why would you think tampons in the home would be an issue, or even tampons missing? Young ladies are soaking these in vodka or other types of alcohol and inserting them either rectally or vaginally and allowing them to sit, and they cause an intense high. And men are no strangers to this as well, because it can be inserted rectally in our young men as well. So this is something that our young people are experimenting with. Average everyday Cool whipped cream in a can, but in this can, in order to create the pressure, is nitrous oxide. And nitrous oxide is what is used in the dentist's office to sedate you and relax you when you're having procedures done. Well, young people are experimenting with the nitrous oxide in here as well, and it causes a high and can cause hallucinations as well. So average household things that you'll see, these beautiful pictures here of potpourri. Young people are actually rolling the potpourri and smoking it, and we thought it wouldn't hurt them, but actually can cause heart palpitations, hallucinations. And so again, simple household items that you may see every day that our young people are abusing or using to experiment with. They can also do things with Freon, which is an air conditioning unit. So I've had some parents say the air conditioning units were breaking down. The kids were breaking into the Freon units of the air conditioner tanks and using them as well. So you've got to be careful in watching what's going on in your household. If the behaviors, mannerisms, trends of your child, they tend to change, those are things you want to key into.
Mm-hmm. And that leads me to the next question. What are some warning signs that that parents could take or could key in on to know that their kids are abusing any substances, especially since these are household items?
Right. Well, I'm the proud father of an 11-year-old, and she has her mood swings and changes. So many of the things that we see in young people when they abuse substances could be attributed to their behavior as a child. The key is, and it could be behavioral, it could be physical. So you have to know your child, and you have to inquire and ask and see what's going on. So if their normal pattern is starting to change on a regular basis, 1 or 2 days maybe not, but they're coming home late, they got a new set of friends, they're being recluse, they're in the room with the door closed and locked, things that are out of the normal behavior of your child. And physically, and all these are some of these are drug specific. You're looking at their pupils in their eyes, if they're dilated or fixed, or small rather. If they have marks on their skin where they could be injecting medications, even infections. So I think the key to answer that question is just being alert and in tune to what's going on with your child. Don't let them go in a room with these handheld devices, which keeps them quiet and you know what's going on. And I didn't mention this, but there's also some brainwave type of drug on the internet that they can listen to that can cause kids to go into some type of trance. So we need to know, first of all, what's going on with our children. Of course, I always encourage parents to limit screen time. So that means not just the television, but the handheld devices as well as the computer, and know what's going on with them and talk to them.
Okay, if parents they do become suspicious of substance use or abuse, how should they handle the situation? The
first thing I tell my parents is you have to ask the question. You can't ignore it. You can't enable your child or just think that nothing's going on. You have to talk to them about it. And there's been some studies that show that parents that have discussions with their children about substances of abuse, the children will develop negative feelings about those drugs and tend not to use them as much. But if they're already participating, you're suspicious, if they're using drugs you think they are, you have to ask them, hey, what's going on? You're changing, you got some new friends. I see these weird marks on your skin. Are you using drugs? You have to be blunt about this. This can be overwhelming for a parent, so you have to be relaxed. Take a deep breath, calm down, and ask for help, whether it be friends, family, or interventional specialists. You have to get someone to help you because these are tough issues. And we have a problem in our country, again, when we talked about the prescription drug abuse, amphetamine salts like Adderall, the medications you take for ADD, the opioids we talked about. So parents have to check cabinets, make sure these things, if they're finished using the medication for short-term use, you dispose of them. So if you have you broke your arm and you got some pain medicines for 3 weeks and the medication, you have 6 weeks of medication, after 3 weeks is up, you properly dispose of it by contacting your physician's office and getting rid of those things. So again, I think the key message is paying attention to your children and asking the questions when you're suspicious you're the parent.
Definitely. I know this was highly informative. I have a question about the synthetics as far as, I know you said that there weren't any deaths, due to synthetic use, but what are some other harmful effects of using synthetics?
The interesting thing about synthetics is that we don't know a lot about them. There is one on the market, and I mentioned that it's called Pink, which is a synthetic opioid. They call it a super synthetic opioid because it's much, much stronger than heroin and can actually kill you. There are also some substances coming into our country from Mexico that are opioid-like substances. They're white powdery substances that the potencies we do not know. And so these young people are getting access to these powdery substances and experimenting with them. Could be a low potency opioid containing product, or it could be high potency. The problem is that there's a potential for overdose. And I did mention this earlier, but the number one reason to overdose in Louisiana or Baton Rouge last year was because of opioids. Overdose doesn't mean you die, but it means that you've taken in too much of that drug and it could be either toxic or lethal. And so again, with the synthetics, we don't know a lot about them. I know some people take these, they call it SHRM, where they'll take a marijuana cigarette, soak it in formaldehyde, let it dry, and they'll smoke that. What effect does that have? We really don't know because those are things that we don't naturally study. So at the end of the day, my strongest encouragement is don't do it. But there's some folks that will take that chance and they're putting their lives at risk.
This was highly informative.
Thank you.
I learned a lot.
Okay, good,
and I hope our viewers.
And I hope you learn not to mess with the household items unless you really need them for what they're used for.
Yes. So I want to thank you again for coming out.
Thank you.
And this is I Care Live. Thank you.